Hey guys, so did you know that there are nurse practitioner programs that are specifically designed for foreign physicians? Let me show you how they all work. If you watched the last video we made, we talked about getting your first healthcare job in the United States while we're working towards becoming a nurse practitioner. Now that you have a paycheck, you got your foot in the healthcare system, you hopefully have a job that's helping you pay your bills. Let's focus on what the real goal is: finding the right nurse practitioner program. This is not going to be a deep dive into every program or every class. This is more of like a roadmap before you start driving. I just want to give you a kind of clear overview of the journey from finding a program all the way to becoming a nurse practitioner, so you know what the pathway is going to look like. Hey guys, so just a quick reminder before we continue that this is only one video out of 5 in the series that I created to help international healthcare professionals to become a nurse practitioner in the United States. All right, let's get back to it. So we start at the beginning. One of the biggest misconceptions is that if you are already a physician in another country, you have to start completely over in the United States. Fortunately, that is not always the case. There's actually a few nursing programs specifically designed for foreign trained physicians. These programs generally take your medical degree as the equivalent of a bachelor's degree for admission purposes, along with the medical coursework you've already completed. You still have to complete a few prerequisite classes, which usually only take a few months before you start the nursing program. As a part of the application process, you're also going to need documents from your medical school. So make sure you bring these with you when you come to the United States, including certified transcripts and your medical diploma. Every school is slightly different. Admission requirements may vary, so always just verify exactly what they require before applying. Once you completed the prerequisites and submitted everything, you're ready to start. From there, you generally have 2 different pathways that you can take to get to your nurse practitioner goal. Hey guys, so if you're finding any of this helpful, please hit that like and subscribe button. It's gonna help me continue to create this type of content and help other people find it as well. So you're gonna have 2 options here. The first one is a direct entry program to the Masters of Science in Nursing and a direct entry to the Masters of Nurse Practitioner. I am going to start with the direct entry to the Masters of Science in Nursing since it's the path that I chose. This MSN program takes about 2 years. After you finish it, you can take your NCLEX and just get your RN license and start working as a nurse. Then you do your postmaster certificate as a family nurse practitioner or whichever specialty of nurse practitioner you want to go with. Now, for these 2 years of the master's programs, I was typically in a class anywhere from 2 to 4 days a week, depending on the semester. Most of my classes were scheduled on weekends or after 5 p.m. since the program was designed for people who were already working. It definitely was not easy. There were plenty of nights during my second year when I did not leave school until around 11 o'clock. Now, during that second year, I also started my clinical rotations. Every semester was a different rotation. It gave me exposure to different areas of nursing. Depending on the school, some of them assign your preceptors, others expect you to find your own preceptors. That's definitely something that you want to ask before choosing a program. It can make a big difference, especially financially. After you graduate from this direct entry MSN, I continued into the 1-year postmaster's family nurse practitioner program. This was an online course. For me, the coursework almost was all online, but my clinical rotation started right away. Every semester was a different clinical rotation. Just like before, some schools provide preceptors, others require you to find them on your own. Finding a preceptor is actually one of the biggest challenges many students face during the nurse practitioner school. Although the lectures and the theoretical coursework were online, I still had to travel to campus for things like the midterms, finals, skills lab, and other required in-person evals. And of course, I completed all of my clinical rotations in person with my assigned preceptor. The second pathway is a direct entry to the Masters of Science in Nursing, directly to the Family Nurse Practitioner program, or again, whichever specialty of nurse practitioner you're going to go with. Instead of doing a master's first and then adding the postmaster's certificate in nurse practitioner, like I did, this pathway combines them both into one continuous program that lasts 3 years. At the end of either pathway, you're going to become a family nurse practitioner. The biggest difference is simply how you get there. One advantage of taking the 2-step route like I did is the flexibility it gives you between the 2 programs. After I graduated from the master's, I became a nurse. I decided to take about 6 months before starting my postmaster's family nurse practitioner. That gave me just a little bit of time to adjust to working as a nurse, get some experience, and honestly just take a break from school before jumping back in. If you don't plan on taking a long time, or take any time off, if you don't want to work as a nurse while completing your nurse practitioner, then the direct entry 3-year pathway may actually make more sense for you, since it just follows you to complete everything in one continuous program. Another thing to consider is the program format. My 1-year post-master's family nurse practitioner was primarily online, aside from the clinical rotations, skills labs, and all of that. The direct entry 3-year program to the nurse practitioner is most likely going to be campus based for the whole 3 years. So if flexibility or distance is important to you, that's another factor worth considering. At the end of the day, neither pathway is necessarily better. They both lead to the same destination. It literally just comes down to your goals, your learning style, your financial situation, and how quickly you want to move through the process. For me, like I said, I chose the 2-step route. I finished the master's first. I worked as a nurse, and then I did my postmaster's in family nurse practitioner for 1 year. Why? It allowed me to start working as a nurse while I did my postmaster certificate. Financially, for me, it made sense at the time. It meant I could start earning money as a nurse, and while I did my nurse practitioner program, instead of doing the whole 3 years. But honestly, the biggest advantage here was not the money, it was the experience I got. Working as a nurse gave me valuable bedside experience, especially when I joined the OR, while I was still learning to become a nurse practitioner. Looking back, I really believe that the experience made me a better and more confident provider today. Again, this is simply why this pathway made the most sense for me. Someone else might have a completely different priority, and that's perfectly okay. So just choose whichever one makes sense for you. And just a little footnote here, the program that I used is from a university called Miami Regional University. It's in Miami, Florida. I have no affiliation with them whatsoever, but that is the program I chose, I went to, and they are why I am a nurse practitioner today. I'll leave a link so you can check out their website. There might be some programs that work for you. So after you complete your master's program, you're going to have to decide which specialty of nurse practitioner you want to go with. There's several options, including family nurse practitioner, adult gerontology, pediatrics, women's health, acute care, and many others you can go for. For me, the decision really came down to two, either acute care or family nurse practitioner. Remember, my goal was eventually to make it to the operating room, hopefully in orthopedics. Initially, I thought that acute care was gonna be my better choice. It would I knew I wanted to work in surgery. It would have given me more training focused on hospitalized and acute patients. But the more I thought about it, I just realized that I also wanted to see patients in clinic. I didn't want my career to be limited to just one setting. The family nurse practitioner gave me a little bit of both. Some of my clinical rotations, I did them in urgent care settings, so I still gained some of that experience treating acute conditions while also receiving the broader outpatient training that comes with the family nurse practitioner curriculum. Another advantage, at least here in Florida, is that family nurse practitioners can eventually apply to be autonomous. They can have their own practice in primary care once they meet the state's requirements. I don't think that's the reason everybody should choose family nurse practitioner, but I liked having that option available in the future. When I looked at everything together, clinic, surgery, flexibility, future opportunities, family nurse practitioner ended up being the best fit for me. Today's goal was simply to help you understand the pathway and give you a realistic picture of the different ways you can get there. I hope that this helped make the process a little bit clearer and gives you a better idea of which pathway might fit your goals. Okay, guys, we made it to the end of this video. Thank you very much for watching. I am putting this together honestly because it's the type of information I wish anybody had given me when I started this journey to go from a foreign physician to a nurse practitioner in the United States. If you're considering this path, be sure to check out the rest of the videos. And if you found this at all helpful, remember to like and subscribe. It's going to help me to continue creating this type of content for all of you. Thank you, and I'll see you guys on the next one.